Recently I had a young woman who had a malignancy and it was life-limiting, and she had weeks to months. And when we sat and talked about whether or not she would want resuscitation and intubation and ventilatory support, she wanted all of that. And it wasn't until she experienced it that she was able to say, I'm done. Now that I know what this feels like, this is not what I want, and this is not how I want to live. But she was, 50. She didn't have a lot of experience in healthcare, and so she needed to experience that to be able to say to the healthcare team, okay, this isn't what I thought it was going to be. I don't want it. In her care, we also thought we could get her off the vent quickly. We didn't realize it was going to be her terminal ventilation experience. So as we as doctors don't always know either. And then there's the older adult who may say, I don't want to pursue a surgery that could potentially be curative or helpful or give them more time, but has lived their life and feels like, I don't want to go through the side effects of chemotherapy, even though I'm a robust farmer still working and doing everything. I don't want the signs and symptoms of that, and this is my time, and I would like to focus on comfort. And I might get called to kind of have that conversation again with this person to make sure that they're making decisions that are appropriate for them and help advocate and navigate the system, the healthcare system, to meet their needs. So I think that the common mistakes that families may make, or caregivers or loved ones, when they're faced with making decisions, are bringing their own issues to the table or their own life experiences instead of focusing on what their loved one's philosophy is and what their thoughts and feelings would be. I also think that in today's day and age, we talk a lot about shared decision making. And so having the team of clinicians collaborate with you and help you figure out how to navigate. So you do want advice. You want to hear from the team what advice, what are the options, which one do they think is a better option or not, based on what you know, what you can bring to the table about your loved one. And this type of shared decision-making model really helps everybody get on the same page and be comfortable with the decisions that are being made. And also helps the caregiver not feel like they're owning the burden of making this decision. There's a lot of evidence that has come out over the past decade showing that caregivers who have to make these decisions have distress for months to years after making these decisions. So we as as providers need to help them through that. And that's where this shared decision-making model is very important, where we need to help weigh in on what are the options and when we hear about who this person is, this patient, and we talk to them what their wishes might be to help coach the surrogate decision makers.